It's a common respiratory illness that can cause breathing problems for babies and even older adults. Along with flu and COVID, it's possible to once again see an RSV surge during the colder months.
And today's medical moment from our team from Corewell Health shares more about what RSV is and what new tools they're using to prevent and treat it.
RSV stands for respiratory syncytial virus. So RSV is a very contagious respiratory virus that is transmitted throughout the globe in varying times of the year, and in the state of Michigan generally comes in the winter months. So RSV actually is the leading cause of emergency department visits and hospitalizations in infants less than 2 years of age. RSV is transmitted by large respiratory droplets, so usually you need close proximity to another person who's infected, and then it causes initially what just looks to be a common cold. Runny nose, nasal congestion, a little bit of cough and fever.
The RSV actually enters the body and actually will sit in the area of the mouth and throat initially. And then over time, it actually can start to descend deeper into the lung tissue. So that lung tissue usually starts to get infected and the body responds. What ends up happening is inflammation enters, mucus starts to get produced.
Even if you're not a young child, you can still contract RSV and you can still shed it to other people. So you may think that you just have the common cold, but that doesn't mean that you don't have RSV, and you could potentially transmit it to a very young child who would be at higher risk for needing to come to the hospital.
Patients who are most at risk of RSV are patients who are under the age of 2 and patients who are older than 65. Patients over the age of 60 often have chronic conditions, and they also have an aged immune system, so their immune system may not respond as strongly. For those reasons, these patients can develop more serious illness if they contract RSV.
And our very small babies, their lower airways are much smaller in caliber than an older child or an adult. So that inflammation, that mucus plugging, can actually interfere with how gas is exchanged in the lungs. And for that reason, these babies can get much more ill with RSV.
This year, we have 2 new tools to help protect adults age 65 and older from RSV. Those new tools are 2 vaccines. The vaccines that are out have been recommended for adults age 60 and older with chronic medical conditions. The current recommendations are to have a discussion with your primary care physician and discuss if you are someone who should receive that vaccine.
We have 2 new weapons against RSV. One is actually for children, and the other is actually for moms. So both are what we refer to as passive immunization.
The idea is to immunize the mom in the later part of the pregnancy so that that mom can generate antibodies to actually cross the placenta, and that actually helps the immunity of the baby once the baby is born.
Now we have a new medication. It's also what we call a monoclonal antibody, which is basically an injection into the baby's muscle that provides high levels of the antibody in their bloodstream. The American Academy of Pediatrics recommends that all babies receive this medication, especially in that first year of life. So you're less than 8 months old who's heading into their first RSV season, that they receive this medication because it is 75% effective at preventing hospitalization due to RSV.
Preventative measures that you can take to protect yourself from viruses such as RSV would be to wash your hands, keep countertops clean, and frequent washing of commonly used spaces, to put your arm in your sleeve when you're coughing to prevent the spread of particles. And if you do feel sick, it's recommended that you should stay home.
To protect your children, the best thing you can do is don't expose them if possible. We anticipate to be as bad this year as it's been in the past, but we've got some new armor this year.
To find a doctor or locations closest to you, head to spectrumhealth.org.